Greetings, everyone. My name is Scott Strother, and I'm the Chief Operating Officer at Well IQ. And I'd like to welcome you to our continuing webinar series with MEDENT. We're going to talk a little bit about organizational culture today. But before I do that, I wanted to just take a minute to thank MEDENT. MEDENT has been instrumental in this partnership. And I think part of the reason was that they recognized in our platform some of the things that we were delivering to our clients. Things like staff level performance insights and improved public review ratings and high response rates. But I think one of the most important things about the partnership is that we share a vision. And that vision really starts with putting the patient first and building value around that experience. And I think one of the best examples of that is the fact that our surveys get put back into the MEDENT patient record. And it really begins this continual loop of feedback that we think is really central to all the benefits the partnership provides. So thank you, MEDENT. For today, I want to review just some objectives. And the first is just when you talk about something like organizational culture, it feels daunting. It feels heavy. It doesn't feel as if it's something that is tangible, and it certainly doesn't feel like it's easily measured. I'd love to be able to say that, you invest $1 in culture today and you get 5 back at the end of the month, but it's just not that simple. I think the benefits of culture far exceed any kind of simple financial metric, but we're going to talk about that. But first of all, we wanted to acknowledge that this is a pre-recorded session. So in terms of being interactive, we'd love for you to be able to email us any questions during or afterwards. And those are a couple of email addresses for your reference. And we really just want to convey the importance of organizational culture and then offer a plan that you can consider to use to impact culture. But if we're going to start by conveying the importance of culture, we need to take a stab at defining it. And this definition comes from a book by Collis Montgomery called Corporate Strategy. And he defines it as a set of norms and behaviors that emerges from the shared experiences and expectations of its members. So it's a long sentence, but it's fairly easy to wrap our heads around. Where it gets a little more difficult is when you consider the fact that it involves changing people's mindsets. And as such, it's difficult to manage directly. We know this, and while we can't manage it directly, we can begin to quantify some of why it matters. And that's really the question here. So one of the reasons organizational culture is so important is because it defines your internal and external identity. When you think about what you want patients to experience when they come into your business, what you want your employees to experience, the overall environment every day, that is what an identity is. And it does so with respect to healthcare across a really changing landscape. There are a few things going on in healthcare today. One is this shift from kind of a volume-based focus to a value-based focus. But the other thing is the presence of telehealth. Telehealth in the onset of it since the pandemic has just been tremendous. And the third dynamic going on is that millennials are making up a huge part of the workplace. And that's not just about healthcare, that's about everywhere in our society. So they are the dominant generation right now. In fact, Deloitte did a study, and that study found that greater than 90% of healthcare organizations are offering telehealth. And recently, a Rochester Institute of Technology study talked about telehealth as being the biggest development in healthcare since the electronic medical record. So that puts it in perspective for you. In addition to that, greater than 40% of millennials are demanding that it's part of their own care. They're demanding that telehealth option. So when you consider these two things, the landscape is absolutely changing. The other thing that has plagued healthcare for a long time has been turnover. In some cases, turnover in healthcare, and this is from Becker's review, can exceed 20%, which is a huge financial burden to many healthcare organizations. So when you think about millennials making up more of the workforce in this high turnover rate in healthcare, one of the things that millennials say is very important to them and a reason why they choose a company is that it's purpose-driven, that it has a purpose-driven culture. And the good news is that healthcare, by definition, is purpose-driven. So the really big question from there is how committed are we to making that purpose-driven culture front and center? In order to show a commitment, we have to know how to affect it. And we think that there are really three ways that we can affect culture. The first is around core values. And those are really the building blocks of culture, and they make clear what the expected behaviors are. The second is around hiring and development, and this creates a clear impression of the company, but it also gives the candidate an idea of what it's like not only to exist in that organization, but to thrive in it. And finally, recognition and rewards. These affirm and acknowledge kind of the output, what happens if you embrace this culture and you demonstrate these behaviors. And this is extremely powerful, and we'll refer back to this throughout the presentation. So we're going to dig into each one of these, and we'll start with core values. And really, culture is just a manifestation of values at all levels of the organization. We know that it can't be delegated, and it really has to be visible from top to bottom. So a question that we ask ourselves, and we have for you, is how good is your organization at showing what the values are and expressing what those expected behaviors are? There are a few different ways that you can support core values. And the analogy I like to use here is really child raising. You know, we think about the generation of children that many of us are raising today. And our parents' generation was the do as I say, not as I do generation. But this generation is more about I'll do as you do. So we have to really think hard about how we're modeling our behavior. And organizationally, it's no different. One of the things you want to start with is a value statement. You know, state how you expect business to be conducted. And as I mentioned earlier, you want to talk about this both internally and externally. After you do that, you really want to associate the behaviors with those values, and not just define the behaviors, but talk about what the goals and the outcomes are, because you want people to focus and have a vision for how things should develop. Lastly, you want to empower it. There's nothing more frustrating than asking somebody to behave in a certain way and support a value or a mission statement, but you have to be able to resource it. It's very frustrating when you don't. So one of the ideas is to create systems that support it and that enable those employees to behave in that way. The second area is around hiring and development. And with hiring and development, you really want to drive engagement and retention upstream. And obviously hiring and that whole process is definitely an upstream consideration. The first part of that is kind of making that fit and understanding what that fit is. And it's like a dating game. When you think about the most useful and productive interviews that you've had, they're usually two-way. It's not just the interviewer asking questions or the interviewee asking questions, but it's really an exchange. And it's a dance around creating a fit. And that's very, very important because it can kind of preempt problems down the road. The second piece is employee development. It's the contract with the employee. What are they going to get for coming into your culture and being a part of it? Are they going to get advancement? Are they going to get learning? Are they going to get financial rewards? So it's important to express this as well. And then finally, there has to be a commitment to assessing it. Assess these behaviors, assess the performance. And the key part here, and it's an interesting phrase to kind of dwell on, is the end doesn't justify the means. Many times in culture, what we want to focus on is how we're behaving. We can't always determine the outcome, but we can always determine the behavior that we embrace along the way. The final piece is around recognition and reward. And there's an old adage in business that says what gets measured gets rewarded, and what gets rewarded gets done. And in healthcare or any other business, it's no different. There are three areas that you can think about when it comes to recognition and reward. And the first really is accountability. And you want to be able to drive accountability, of course, but it's important to do it naturally, because accountability is one of those words that people hear and they think big brother. But what you really want to do is encourage that valued behavior. And when you can do that in a way that isn't intimidating, that becomes it drives a natural accountability. The other piece is you can do it in a positive way, not a punitive way. It's easy to kind of use the stick, but the problem with the stick is that it stifles creativity. It makes people very scared of making mistakes. Instead, use the carrot and promote confidence. Confidence can be one of the most powerful emotions organizationally. And finally, you want to create a culture of recognition. And this recognition piece just creates tremendous energy, very inspiring and infectious. In fact, one of our clients early on when we deployed our platform, we were in a week or so after it launched, and we had a meeting with the CEO and the COO, and two of the employees barged in and just asked if we were the guys from Well IQ and started ranting and raving about how great the platform was, how they loved to have their pictures up, and they had healthy competitions internally and between locations. So that really just was our aha moment of how impactful culture can be. So we all want to ask ourselves, how good are our organizations at rewarding our performance and rewarding our behaviors? So we talked a little bit about defining what organizational culture is and gave you some ideas about how to affect it. But let's talk more specifically about how the Well IQ platform can help in this respect. The basis of our platform is always plan, execute, and review. And this is pretty fundamental to any strategic endeavor. So there's three ways that we can truly help healthcare organizations impact culture. One is by surveying patients. We can do this in real time. We can do it consistently, and we can do it regardless of the patient journey. They may see different parts of your organization from appointment to appointment. So Well IQ can do that. Second thing we can do is help you analyze the data. We can help you analyze that data in real time. We can help look at data that is staff level performance wise. And this is just one example of one of those reports, but it's important that you analyze it. And when you do that, you can begin to get a picture of what are these behaviors, are the values that were important to us as an organization resonating with our patients. And finally, we can help you measure the results, whether that's by doing internal surveys on our platform, or it's by looking at how engaged the employees are and how people are reacting to it. These are things that we can help with. We can also identify trends that are happening in the industry and within your vertical. So that's our end of it, but there's also some actions that the organization has to take responsibility for. And really that's around executing feedback improvements firstly. And that's where you really start to make improvements that are demonstrable, that people can see. One of the most important focuses here is linking patient satisfaction to staff performance, because those two groups are really the basis of your culture. They are coming together in your environment, and what they do, the output of what they do, is critical to your business. So we should ask ourselves, how good is our organization at linking patient or customer satisfaction to staff performance? Very important consideration. The second piece is you have to gather and celebrate, recognize and reward that performance, and do it in a way that's loud and proud. One of the things that this helps do is take this accountability idea, which can be a little scary, and turn it into ownership. And ownership is sort of like silent accountability. When it happens, it's so effective. Lastly, you want to measure the results. There are ways you can do that. You can take a pulse of how people are feeling internally, working for your company, and you can also look at some of those retention numbers and turnover numbers that we talked about earlier and measure that. To summarize, we want to have three key takeaways from today. The first is the need to empower your organization's values. You do this by providing the tools for success throughout the organization, making them visible and making them accessible. Secondly, we have to assess staff development. And that means gathering and analyzing feedback, not only from the bosses, but from all stakeholders, including patients, staff, and partners. And lastly, we need to recognize and reward not only the achievement or the end game, but the performance and the behaviors used to get there. Okay, we've gotten to the point that we're going to demonstrate part of the platform for us, and I'm going to ask our CEO, Peter Harnish, to do that. But I want you to think about throughout the presentation some of the things that we've covered in this discussion on culture. Some of the things such as values being front and center, a very transparent way to ask for feedback, and the idea that this feedback is the quality of it goes down to the staff level. So I want to thank you otherwise for your attention today, and please I want to encourage all of you to use those numbers to ask any questions or provide any insight. We really appreciate it.
So let's try out the demo. What I want you to do is text the word demo to 858-314-3503, and it's going to give you an example of a patient survey. You're going to get a text message back with a link, and when you touch that link, you're going to be dropped into an example survey. So again, the number and the word to text is in the bottom left corner here. But once you do open it, you're going to see this example, and the first page is just an overview of why you should be giving some feedback. We always like to put an incentive in here. We suggest it, maybe a quarterly patient appreciation drawing. And then at the bottom, you see the language. So there's many different languages we can do. By default, we have English and Spanish, but we can customize that. And you can change it quickly and go back to English if you like. And this is a patient journey that has 3 different touch points: the reception, the medical assistant, and the clinician. So in this case, I'm going to say, you know what, I saw Nancy, I remember her. And as soon as I proceed to the next screen, I have the opportunity to choose endorsement badges, which represents the behaviors that are important to us, what we expect from this positive patient experience. And it's a way for us to measure up against it. By default, I think the ones you're seeing are going to be all positive, but we can customize these to be non-positive. But of course, if you scroll down, after I choose a few of these badges, I can always write some feedback in the bottom that maybe is going to reinforce the great behavior I saw, or it may explain a bad experience I had too. Once I've done that, now I can start to proceed through. So the medical assistants, if you wanted to, you could choose one of them. Same with physicians. There'll be a screen on the facility, and then eventually we get to this. How did we do overall? And you see the 5 faces here. Now, if I were to select the sad faces, it would actually create that actionable event, and we would be notified by it. In any case, once you move on, you may see this. It's a spin for raffle entries. So you can spin the wheel if there was an incentive set up. And on the last page, you're going to have the opportunity to go out to public review sites and leave your review. And this can be Google, Yelp, Facebook, whatever you may want to put in there as an actual practice. So it's very simple. It's the easiest to use survey that gets you the most data that you can possibly have about staff, departments, and the organization overall. I'm also going to quickly run through just a couple of the pages that are available should you want to log into the actual WellIQ dashboard, because you're able to see a lot here. It shows you the number of surveys you're sending out, which is that top portion of this dashboard. It has your overall patient satisfaction or your WellIQ score. It tells you how many surveys have been sent and completed, and what are the top behaviors, the top endorsements that the patients have been giving your staff. You can then also look at the department and which one has been receiving the most engagements, as well as the staff, so that you can see who's been excelling this particular month. And at the bottom, again, addressable events where you want to take action. One of the reports we really like is the most engaged staff, because it starts to show by location, by date range, what are the behaviors that the staff members are receiving and who's receiving the most of them. This can impact training and so much more in your organization, but it's here on a simple screen where you can report and analyze on it. We have the overall patient satisfaction report where it breaks it down by location. Again, a great measurement is just how are your patients responding, because this is going to give you that subset of patients that you'll be able to start identifying where you're going right and where there could be some improvements. And finally, I just like this report as well. It is the most used badges report, and it shows you what are the behaviors that are resonating the most with your patients. And just like you see the ones that are resonating, the ones that are lower on the scale, they may be areas that you would like to improve on. So a great way to start seeing how patients are engaging with you and what they believe is the positive impact you're having. All of that ties back to a great patient experience, being able to get feedback on it, and then taking actions on the feedback you've received. And with that, I want to remind you again that it's medent@welliq.org. Please email us. We're happy to have more conversations. We're happy to describe more of what we do, take you through demos, but we're very excited about our partnership with MEDENT and how we're impacting patient experience as well as many other areas. So stay tuned for more of our webinar series. And again, I want to thank you for taking the time.